Welcome to another Medical Minute. We're back at Colorado Springs Orthopaedic Group with Dr. Christopher Jones, and we're talking total shoulder replacement. Good morning to you, Doctor.
Good morning.
Okay, so what is a total shoulder replacement, and when do you recommend somebody get it done?
A total shoulder replacement is when you're replacing basically the ball and socket of the joint.
Okay.
This is actually an actual implant that we use. So the ball usually attaches to a stem of some sort, which goes inside the humerus. So you're replacing the ball with a metal ball, and then you replace the socket with a metal lined socket. So in the purpose of doing this, or when you do this, is when somebody has complete breakdown of all the cartilage in their shoulder. So they have no cartilage and they lose mobility, and pain is really the primary reason to do the surgery.
Of course. Let's say somebody comes in, a patient that is younger, gets a total shoulder replacement procedure done. What is the lifespan of that procedure? How long is it able to function? What is the lifespan of it?
The statistics show that the 20-year survival rate for a shoulder replacement is like 85%. That is using kind of older implants. I think some of the newer implants, we're hoping that's going to be better. But we do have concerns in younger patients, you know, that someday we have to redo it.
Now, are there ways to prevent arthritis within the shoulder to avoid a total shoulder?
You know, the vast majority of people that end up requiring a shoulder replacement have a genetic component of arthritis, and you know, when you start asking them questions, they're with their dad and their grandfather had bad shoulders. The things you can do to prevent are post-traumatic or after injury arthritis, like avoid dislocations and take care of your shoulders. You know, you're not bench pressing 400 pounds and stuff like that, but a lot of the folks that need shoulders, it's genetic.
All right, so let's talk about the procedure itself. What is the recovery time?
Well, full recovery from any shoulder procedure takes about a year, but the vast majority of patients that have had a shoulder replacement, you know, within 6 weeks have less pain than they had before surgery.
Wow, which is great. Are there any different types of implants you prefer to use when doing this procedure?
Yeah, that's one of the exciting things about shoulder replacement is shoulder replacement is still in its infancy as compared to knees and hips. So there's still a lot of innovation happening in terms of the implants. So a lot of the implants are really becoming more bone preserving, you know, meaning that you're not taking away hardly any bone. So that down the road, if something else had to be done, there's still bone to work with. So kind of going to more implants that, I guess, take out less bone and leave more to work with in the future.
Yeah, you know, technology has really come far, especially in the medical field. Are there any innovative technologies within the total shoulder procedure that you utilize that's been pretty groundbreaking? Oh,
absolutely. So one of the biggest things is utilizing three-dimensional planning. So basically every shoulder that I do, before I even walk in the operating room, I've done the surgery on the computer. So we download the patient's imaging into the software, and I can put implants in and move them around, and when I walk into the operating room, I already know exactly where I'm going to put them. So that's really helped with shoulder replacement.
Yeah, that sounds like a big deal. So how does a traditional total shoulder procedure vary from a reverse total shoulder procedure?
So reverse total shoulder is when you basically swap the ball and socket around. So the ball goes on the socket and the socket goes on the ball. And the reason that we do that is when somebody doesn't have a rotator cuff. If you don't have a rotator cuff to hold the ball in the socket, then that's when you have to do the reverse.
Got it. Well, great information. Thank you so much for talking to us this morning. All right, everybody. And if you would like to learn more about Dr. Jones and his team here at Colorado Springs Orthopaedic Group, just go to csog.net.
All of that information is up on your screen, and this segment has been sponsored by Colorado Springs Orthopaedic Group.
That's right. All right, Dee, we're ready for more clues.